on the recording. There we go. All right. Hi, everybody. My name is Sarah Sarelson. It is great to see you all. And I'm super excited for today's presentation. I have been working with Casey Quinn from Wyoming 211 for a while now, and he is doing incredible work and is going to share that with us today. So I will go ahead and turn it over to you, Casey, and you should have controls. Yep, there you go. Looks good.
Hello, everyone. My name is Casey Quinn. I am the Community Engagement Manager for Wyoming 211's new Community Information Exchange. So what is a CIE? Apologies. I'm getting pop-ups. Who knows Zoom better than I do? How do I remove the top, Sarah?
So I don't see any top.
Oh, you don't? That's fantastic.
I just see your slide. You look good.
Good. Okay. Apologies, everyone. I'm more of a Teams Meets guy, and Zoom slides in about once a month. So what is a CIE? A CIE is a centralized technology system that allows organizations to coordinate care with one another. So what does that mean? That means they are sharing a common intake. They're sharing case management notes. They're sharing a client record. They're sharing screening tools. And above all, where it gets most of its utility, they're making electronic bilateral referrals to one another. And then they're responding to those referrals. And the point of all this is so that they can keep track of their clients, making sure that they're receiving the services and closing the loop on referrals. So I think a use case that would be relevant to the FRC is a family, the Johnson family. They recently moved to a new town and they're struggling to settle in. So they visit the local family resource center and they're seeking assistance. The center staff member, Sarah, sits down with the Johnsons to figure out their situation better. Sarah learns that the Johnsons are having several issues. Mrs. Johnson has been unable to find employment. Miss Johnson can't find affordable childcare, and they have concerns about suitable housing. To assist the Johnsons, Sarah accesses the Family Resources Center's CIE platform, Communicare, and then she enters the basic information about the family into the system. And then she generates a list of relevant resources and services available in the community. So Tara says you need employment services. Here's a direct referral to those that offer those, maybe resume assistance. You need childcare options. So Sarah helps Miss Johnson apply for childcare assistance through the appropriate channels. Housing assistance, depending on where you're at, that's kind of a struggle in Wyoming, but maybe there's something that's provided within, the community that they're at. And then on top of that, Sarah's able to receive confirmation from those organizations on whether or not they can actually offer those services. So by leveraging the CIE, the Family Resource Center can provide personalized, comprehensive support to the Johnson family, addressing those immediate needs while also helping them to build long-term sustainability. So Wyoming 211 is the backbone of the CIE, which is really puts us in a good spot for launching the system. There are other bilateral referral systems that exist, but oftentimes they're out of the state. What we're fortunate for having 211 is that they have over 10 years, we have over 10 years of trust built within communities. We also have over 2,800 resources within our database. And I should clarify, I'm sure a lot of you have, I believe Olivia Schoen, our marketing director, has presented to the FRC group, but just to clarify, 211 is an information and referral system for the Health and Human Services. So it was initially created to remove stress off 911 calls for non-emergency issues. So if you need utility assistance as a client or you need food or clothing, you can just call 211 and our call center specialist will point them in the right direction. This is also why we encourage our partners to tell their clients to call 211 when they're done offering their own services so that maybe they can get help in the additional areas of their lives. These are some of our current partners. As you'll see, a lot of them are currently Laramie County oriented. That's because that's where we started. However, we expect this to grow substantially. This is a mix of our steering committee, pilot partners, and then some statewide entities. Our most exciting ones being the statewide Family Resource Center, which we hope to be a foundation of to help bridge gaps in coordination. We're also working with the Department of Health Chronic Disease Prevention, and that's to onboard healthcare systems in relation to cardiovascular health and diabetes. So the service we actually offer, we have multiple levels of service, and they're related to the amount of technology used as well as the capacity of the organization. So maybe you're a small group, you only have one or two people, and you don't have the capacity for case management, but you do want to receive referrals. We offer this level one where you're just receiving emails, you get information on the client, and then you can accept, decline, and respond in notes to that referral, but you're not making bilateral referrals. You don't have case management notes. Maybe you are working for a dispatch team at a hospital, or you're working for a community action, or a large organization. You want case management notes, you want screening tools, you want to see the longitudinal record of this individual. Then you could be our level 3 partner. And then we also have the second level that's kind of in the middle, where it's you don't want all the case management tools, but you want to be able to make referrals out. So let's actually take a look at how this thing looks. Let's see. So this is the login page. I will say there's a couple more things that we are still building out. We have a client search, we have a referral status dashboard. I won't show you the dashboard. I do have an image of it on the slideshow, but that's because this is the live system. That means if I were to go to the dashboard, you'd be able to see actual clients, and that would be a big HIPAA mistake. So I'm going to go to the client search and actually look for an actual client. We have this fun one we've created. Pistol Pete, there you are. So the client record looks identical to the client intake, except it's just filled out. So within the system, we have this intake. It's basic demographic information, information on the client, personal information. This was designed by our steering committee, which is made up of various organizations within Laramie County. And the idea was to get the minimum amount of information necessary to make a good referral. So there might be stuff that doesn't interest your organization, say income, maybe veteran status. However, if you're making a referral to, say, a utility assistance place, they might care about your income. This is our referrals module. Within here, you can see we have a consent piece. There's actually multiple levels of consent. This is our current pilot group that's in there. This is expected to change in view, but the point of this is to give more control to the clients over their data. We can actually email them the list of the organizations that can see their information, and they can opt out from those organizations from seeing it. We also have the referral module itself. As you can see, we have keyword. That's kind of like a Google function. Then we have the taxonomy that's associated more to 211's taxonomy, which is very robust, and we actually encourage our partners to use it because you will find stuff in there you didn't know existed in your community. Or maybe you know exactly who you're referring to, and you could just type in the agency name. So in this example, let's look up pharmacies. And I'm not sure where this individual is. So it also does it based on geographic location. And Pistol Pete, I put in Laramie because that would make the most sense, right? Let's change that to Cheyenne because I'm more familiar with the services around here. Oops, 8202. So within here, you can see multiple pharmacies. There's a lot that exist, but maybe you want more information on them. You have Walgreens, and that's real basic, but maybe someone helps, with pharmacy assistance, financial items. I didn't really specify this too good, but HealthWorks is in here. And then also on there, you can see that they are in fact in network to the CIE. So I can select them, and now the referral can be made. So really, I don't have to put anything else in here, but this is exactly what HealthWorks is going to receive. They're going to see that as requested on this date. An additional line of consent to share data occurred, and then they can accept, they can provide it, or they can decline it, and they can state why they're declining. Maybe there's a lack of funds, maybe the person didn't show up. You could put additional information in there, and then you can send that out so that people can keep track of it. We also have a case management section, which this we plan to keep building out so that you can have more of a coordinated team. You can assign a case manager. You can look at notes that have been put in by other case managers. This we also think we will develop out a little bit further, but otherwise in the meantime, it's been working pretty well with our navigators that exist in the system. A follow-ups tool, the document uploader. Organizations have seemed to like that. One of the biggest barriers to receiving services is showing up to the right place with the wrong stuff. It would be fantastic if they had that, the documentation all ready to go. And then screening, we do offer screening. So we actually internally at Wyoming 211 use the AHC screening tool. We understand that's becoming more popular. That's what our navigator likes to use. So we can hand that out right away. However, we are also able to incorporate whatever SDOH screening tool that you utilize. I'm assuming there's not an exorbitant price tag associated to utilizing the digital copy, which we found that out with Prepare actually. So we're trying to work around that. But otherwise, whatever you use, even if it's personal, something you made, we can incorporate that into the system. And then along the side, you can see this person's record. Pistol Pete is our guinea pig, so he has lots of problems and received lots of services over the course of the last 4 months. Generally speaking, it won't be this long. Things are a little bit easier to find. Oh man, yeah, Pistol Piece just gets longer and longer. I'm gonna have to create a new character. You can also see a referral history at the bottom of the referrals. So that is essentially the system itself. And then this is in case I don't have access to my login credentials. Um, the other thing I wanted to show was this dashboard, which is right here. And what the dashboard allows our partners to do is you can actually receive referrals via email, but you can also log into your dashboard and you can see incoming and outgoing referrals and whether or not they're pending, whether or not they've been responded to as accepted, declined, or service provided. That is kind of our last technical piece that we're still working on. It does function, but we're having a little bit of issues there. When it does work, it's a fantastic tool, but at the same time, it's not completely necessary to the functioning of the system. So there are security elements to this. It is a HIPAA compliant site, the deployment of separate protected instances. I think that's like variations of code for the site, so it's harder to hack. I'm not entirely sure. We pay a lot of money for it, so I assume it works well. We use strict privacy measures. There's multiple layers of auditing. We have third-party auditors, the vendor who is creating the system with us does our own auditing, and then we also will be developing our own internal auditing. We have policies associated to privacy and data breaches. And then in addition to our partner agreements, which have a data use agreement within them, if you are a covered entity and you deal with PHI, health information, you will have to sign a business associates agreement. And then we have QSOAs for those that work with clients with substance use disorders, because there is another layer of legality there. So you would see that more with, the VOAs and community mental health centers. So you also have access to 211's navigators and case management. So maybe you're a small organization like Meals on Wheels in Cheyenne, and you get a client that has a lot of needs and would be a perfect fit for case management. Maybe they're homeless, maybe they're struggling veteran. there's a number of things that can make someone slightly more unique than the average person that walks in. You can actually make a referral to Communicare's case manager. And we currently have one. Her name is Rachel, and she's absolutely fantastic. And she will do case management for that individual and keep track of this individual and monitor their goals and work with them for as long as it takes. The same also applies to our Aging and Disabled Resource Center. We have navigators there, as well as our kinship program for those that are taking care of non-biological children. So you have also an access to these programs within the CIE. System integration. So currently, we're working very closely with Epic to develop an API, which is an application programmatic interface. And that's really just means making two systems talk to each other. And that means logging in once. So you're not logging into Epic and you're not logging into Communicare. I know Epic isn't all over the state, but this is a starting point for us. We have integrated our database into Epic, or we're currently in the process. And as far as we know, or from what we last heard, the API is essentially completed and they're testing it out in Wisconsin. And then we will be able to utilize it here. So if you're an Epic user, that's exciting. If you're not, as many organizations aren't, this is our first step into creating those APIs into large electronic health records and other databases. We are in the midst of our pilot program. We have 8 organizations within Laramie County, and they all offer various services from, Community Action, HealthWorks, Shine Regional, uh, Meals on Wheels, Recover Wyoming, Enroll Wyoming, and a couple others. And, we're doing this pilot so that we can see what works good and what doesn't work, what kind of technological issues we might be experiencing, system design flaws. And overall, it's been a wonderful pilot. We're learning a lot about the system. We've made changes based on the recommendations of users because we want this to be user built. We are, however, extending it beyond that 8-week period because we want this to be a almost perfect system when we release it to our statewide partners. This is more marketing related, might not concern you as much, but we do have a plan to kind of maintain marketing within Laramie County and then to our statewide contractual obligations, which the FRC is one of those, which is why we're not pertain as much. But we're hoping that within 1 year, we will have full-scale operations. That is several more hired positions, which would be another IT person, another navigator, and then possibly another person on top of all of that. If you want more information on the CIE, you can reach out to me directly, um, or you can go to wyoming211.org and under programs and partners, you can look at the CIE and there's more information on it. You can drop a interest request to me. But also, please, I encourage you to view the rest of the site. Wyoming 211 offers a ton of services, and we have a lot of fantastic relationships and partnerships that you can access through the website. So that is the CIE. Does anyone have any questions?
Casey, I'll throw out a question that was asked last week when we were talking about this. And while you all are thinking about all of the rest of your questions to ask. So one of the questions was the cost to be involved for our Family Resource Center partners. And so I'll let you share that.
Sure. Outside of APIs, the only fees really exist are with user fees, which will be covered certainly for this first year and hopefully thereafter. We are currently in the process of developing something, an actual fee structure, but we want it to be, we don't want cost to ever be a barrier to our partners. And then we do have grants money that covers those fees for some time. I think when that fee structure does get developed, it will be more based on the size of the organization. So, a nonprofit would very much differently, and we'd probably cover those costs as well than say a large hospital. but we are still in development of that.
Hello, this is Kyle Borger with
So I have a question. Oh, go ahead.
So once you have the API working for Epic, I would imagine that will make it easier to do other APIs for other case management programs as well, provided that they will properly receive it.
Sure. Well, for one, it'll be easier because all our attention won't be on Epic. This was kind of our first experimental API. We're also starting to look at other translative tools, intermediaries like Fire and Cumulus, Rhapsody, to kind of speed that process up a bit. However, VisionLink, our vendor, does have an API building process. I think it'll be really dependent on what the database is that we're tapping into. Is it a large EHR? Is it just your internal database? But yeah, once this Epic is completed, that opens up a lot of doors.
Wouldn't it be nice if we could just put it in one program and it shared with everybody?
Yeah.
So we, a couple of years ago, were approached by Unite Us. Sounds a lot like the same thing, taking that 211 information, which we are, as a child development service, we're listed, as a child care and stuff like that. How does this differ from the that they tried to do 2 years ago?
hmm Um, I'm trying to think to remain as objective as possible. Um, it's because there's, I don't want to besmirch them in any ways because I think it's a well-functioning system on its own. Um, I would just say about us, we're a nonprofit that exists within Wyoming with Wyoming employees. The system has been built by Wyoming employees as well as users from similar organizations, that are here today. Um, it is handcrafted by Wyoming to a degree. The technical assistance that exists, the hands-on training. I'm there. I train, I onboard. The people at 211 are holding hands the entirety of the way. So I think there's just from a program point of view, an entirely different feel because it's native to Wyoming. And then, there's smaller things. We offer different tools. We make changes based upon the requests of our users. We're not beholden to other states. The whatever happens in interest in, say, Arizona doesn't impact how we build our system, just how you guys would suggest. I mean, that's really it.
Yeah, I know. I asked that because nothing ever happened. I mean, like we joined and then for free because we're a nonprofit, and then nothing ever happened. So that's why I asked, like, how is this going to be different? Because I want to jump into this. One of our big things is putting a digital footprint out there that will help connect the different resources in our community. That's our huge focus, is that everybody's reinventing the wheel. So personally, in Fremont County, we're trying to, make that a smaller footprint that's more accurate and more functional. Um, so I'm interested to see how this goes, and I'm happy to be a part of it in any step of the way. If you need extra people to try things out, we'd happy to join you in that.
Absolutely. Thank you. Yeah, I mean, we, you know, we have a fantastic foundation to stand upon just because 211 does have this decade record of good service. Um, so it certainly helps as far as credibility.
Casey, can I jump in really quick also?
Sure.
This is Sabrina with Wyoming 211. Courtney, I think that's an excellent question. What about Unite Us? I would say that the platform infrastructure is very similar, but to Casey's point, all of our work is Wyoming based and based off of our Wyoming communities. Our platform is flexible and nimble. We can add and take away, whereas Unite Us is very much an out of box product that you get what you get. One thing that I have also recently learned is that there is no more Unite Us representation in Wyoming. And so bringing new people onto that system while it still exists, onboarding new partners and whatnot is not alive and well right now. And as you mentioned, it's didn't go anywhere. I think that speaks for itself that there. But I'd also like to add what we also bring to the table is our full resource database. So if you are a participant within the CIE, you have access to all 3,000 of our resources statewide, where if you are a CIE partner, you'll be able to make those bilateral referrals to one another. But if you find an out-of-network organization that is not a CIE partner, you'll still be able to access those resources and provide that to your client and help them get connected exterior of the CIE. So I think that that's probably one of the biggest benefits that we can bring to the table.
Thank you.
Sean. Well, if there aren't any more questions, please follow up with me. I find that I put a lot to digest in just a 20-minute space. So please reach out to me. Please visit wyoming211.org and visit the CIE, or reach out to me at cquinn@wyoming211.org.